I hope y'all never get this class because
I gotta be in it.
yes, this is the best way to participate in it. So today it's going to be about rare surgical procedures and ailments, specifically the Zenker diverticulum. Sorry. Last time I had this, it was not that fun. So today, I'm going to talk about my husband's personal journey with it. Zenker diverticulum is so rare that only 1% of people get it. And in between the genders, it is more women than men. So him as a male having it in itself is already rare. So what it is where there's a pouch that forms in the back of the throat, in between the throat muscles, and it can block off the air and or food supply from getting to the stomach, depending on the severity of it. He had it in the back and it was about the same diameter of the esophagus. So the diagnosis for it is very common to GERD, so a lot of people miss it. Sorry. So knowing what your body throws at you and being able to take stock of it is very, very important. So if you feel like you actually are sick, but everyone tells you, no, you're fine. If you really feel like your instincts tell you to get it checked out, get it checked out. So I'm not doing so great on this, I promise. The first try was way better.
You're fine, you're fine.
When my husband was told that he needed the surgery, it underscored the complexity and unpredictability of our body. And I actually kind of sort of went over this already. Zenker diverticulum, it forms a pouch, disrupts swallowing, and if food builds up in it, can cause emesis, which is regurgitation of the food particles afterwards. The way it is detected is by a barium swallow. My husband, he had a modified barium swallow, which was basically a thinner consistency of the dye. And it reveals the location. It doesn't take very long, but it does cause, and it could cause constipation in some patients. So depending on the severity, yes, I know this is very good nitty gritty, and if you don't like that, the next one's gonna be better, I promise. So, it's been a while since I looked at these photos. So the interesting different thing about my husband's diverticulum is that it had a hernia on the top of it, and that opens it up to other cavities in the body. Yes. So to remove it, depending on the severity, there are the intense standards, which is a complete removal of it, which is called the flexible endoscopic cricopharyngeal myotomy, where they go in and they have to basically reconstruct your valve at the very back of your throat. Some, which I recently watched a video explaining, is less severe and literally just gives it a little bit more space, like an earplug. It's called a stable assisted cricopharyngeal. Now through this whole process, the hardest thing about it was maintaining nutrition. My husband got down from a normal male's healthy weight of 160, 170 to 129 in 2 months. It was very difficult, and keeping to a liquid diet was one of the big keys. And also keeping a food diary. That way, every day, us humans require 2,000 calories per day. So maintaining or exceeding that is even better, especially if you're not able to take food in the normal way. Plus, honey also helps. It's a natural antibiotic. So the other part was the healing process. The healing process actually was extended, sadly, because my husband got his opening wound for it became septic, and he had to go back to the hospital for another month or two. And he had to get hooked up to some devices that I was iffy about. So keeping your area sterile while you're trying to heal is very important. This is the device I was telling you about. It's a vacuum-assisted closure, and it is fitted with foam to fill the wound. That way your body can naturally heal and close up. Whenever he was going through the healing process, he was on this negative pressure wound therapy, and also when he got out, I had to get trained by his medical staff to daily keep up with his hand-packed wound. He always joked that I had my hands in his throat, and so our relationship was pretty good. So I kind of want to close this one with, again, the persistence of, keeping up with your own body, knowing the signs in case you do have something wrong. Be your own advocate. A lot of the medical field, they get really busy. They're like, well, I have this person, and you're like, well, I know something might be wrong with me. I don't know exactly what it is, but I know that I need medical attention for it, and push for those tests. Even if, you still have to fight your insurance, that's an ongoing thing in this society. But making sure that you do read your body signs could keep you from rare diseases and ailments.